Hello.
Hi,
Could you introduce yourself and what you do in urology, please?
so my name is Professor Hashim Ahmed. I'm Chair of Urology at Imperial, and I'm also a consultant urological surgeon at Imperial College Healthcare NHS Trust.
Nice to meet you.
Nice to meet you too. Glad I'm doing this. So look forward.
Amazing. So obviously we're doing this for Urology Awareness Month, which is in the month of September. We want to target this interview towards just the general public and professionals that work across the world so they can be better informed about the major issues and conditions in urology. So my first question is, off the top of your head, what do you think are the most pressing issues in urology right now?
Yeah, it's a really good question. And if you exclude things, you can end up offending people. But in my mind, early diagnosis of urological cancers, of which there are a number, and we can talk about that. Urinary symptoms in men, which especially those above the age of 40, due to benign enlargement of the prostate. And then urine infections in the general population, men and women. And then lastly, stone disease. So stones forming in the urine can cause quite a few issues if not dealt with early.
Okay, so should we start with what you think is perhaps the most pressing issue or the one that causes the most burden of disease worldwide? Which one would you say that would be?
Yeah, so worldwide, the Lancet Commission on Prostate Cancer said that this was going to lead to hundreds of thousands of men being diagnosed over the next decade or so with prostate cancer. So it's turning from a Western phenomenon to a global issue because of increased life expectancy, increased awareness. So men are going and having blood tests to check for their prostate. So that's going to be a big burden on the general population and for healthcare professionals.
Okay, so what do you think that the general public should know about prostate cancer? What's the most important key take-home messages for them?
So there's a big debate raging about whether we should be screening for prostate cancer. And for those of you who know about screening, it's about finding the disease early enough so that you can find it in a curable state and you can improve that patient's life expectancy. But equally, on the flip side, you don't want to find things that would not cause harm, because by trying to find things that don't cause harm, because some cancers don't cause harm, they just sit there, they do nothing. And in prostate cancer, that's particularly important. Lots of men die with the disease rather than from it. And if you start to find those, first of all, the tests that you use to find those can be problematic in terms of the side effects and complications, and then the treatment that you give and the psychological burden of living with a cancer that you've diagnosed, even if you tell the man it's not something that's that important, can be really issues which are negative aspects of screening. So those WHO criteria that a lot of you will be aware of, the Wilson and Younger criteria, have to be met. These are things like, can you find it? Can you find it safely? If you treat it, do you make a difference to patients' life expectancy and quality of life? That sort of thing. There's 7 criteria. And we have to meet those criteria in order for screening for prostate cancer to be approved. At the moment, only one country, Lithuania, approves screening for prostate cancer. Every other country does not, because that balance between harms and benefits is not quite there.
Sure. Sounds like a difficult balance to manage.
It is emotional, because patients who've been diagnosed with advanced cancer quite rightly ask, if there was a screening program, would I have been diagnosed earlier? And would that have made a difference to my life? So it's very, very important that we listen to that voice. Equally, there's lots of people who say, well, I don't want to be investigated. I've heard the arguments. I don't want to have investigations. I don't want to have treatment. So we have to listen to both sides.
Sure. It's like he's mentioned, it's a life-changing diagnosis for a lot of people. Naturally, there's a lot of information out there about the condition for this reason, both factual and scientific fact and misinformation as well. Where would you recommend that people go and find their information about the condition?
Yeah, I think there are two really good websites for this. So the Cancer Research UK website on advising about early diagnosis and treatments and the different cancers, and they have fantastic information on prostate cancer. And then the Prostate Cancer UK charity, again, have brilliant information on how to check whether you might have cancer, what to do if you have urinary symptoms that might be concerning you, or a family history, how you get diagnosed, the pros and cons of that, and once you get diagnosed, how you get treated. So I think those two websites are written really well. They're written with medical input, and they're cross-checked and validated so that it is true to the evidence out there and makes sense to patients. So a huge amount of work has gone into that.
Sure. We've mentioned this a little bit already with the resources and charities. What else would you advise professionals that work in this field to do to better take care of prostate cancer and work with their patients?
So I think the key is patients deserve to know the positives and the negatives. And when a patient or a potential patient goes to their primary care doctor, a general practitioner, some of them tell stories of being put off from having a PSA test or being refused to have a PSA test. Now, I think that's a minority. My colleagues in primary care are very good at talking to patients about the pros and cons. But I think we all, if we're asked to do a PSA test or a prostate-specific antigen test, this is a blood test that checks for whether you may or not have prostate cancer. It can be high in the presence of prostate cancer, but it can also be high because there are other conditions in the prostate which are not cancerous. So it's not a great test, but it's a reasonably good test. And there are pros and cons to that. So if a man requests that, I think it's important to tell them about those pros and cons before that person makes the decision to have a blood test. So informed consent, I think, not only at that point, but when they get diagnosed with different risk categories of prostate cancer, that informed consent is really important. I, as a urologist, mustn't focus only on the surgical option. We must tell them about all of the other options: radiotherapy, brachytherapy, minimally invasive focal therapy, monitoring, active surveillance. So, and then we must offer the opportunity to those patients to go and meet with other specialists. We are not specialists in everything, and we all lack knowledge, and therefore we must accept that we have limitations in how we can advise patients. We must always offer that opportunity for patients to go off and speak to somebody else.
That's quite an important message. We've spoken a lot about prostate cancer. You mentioned three other sort of main issues in urology at the moment, that being Stone's disease, infections, and male urinary symptoms. Should we sort of do one take-home message for public and professionals for each of those, starting with Stone disease, if that's okay?
Yeah, so Stone disease can occur because you have a family risk, but that's quite rare. There's some kind of metabolic condition that makes you produce certain chemicals that are more likely, once they get excreted in the urine by the kidneys, they cause stones to form. Most stones actually form because of dehydration, and you get very concentrated urine, and the calcium in there, we don't know exactly what happens, but the calcium in their urine plus a bit of debris of tissue get mixed up, so they start to aggregate and they form stones. Most of the time, those stones will just pass once you start to hydrate more. Some of those stones can just sit there and get bigger and bigger and block your kidney. They can cause infections, which are very serious. because bugs get in there and effectively just sit in the stone and can cause repeat infections. They can also cause bleeding, and often stones in the kidney present as pain in the back, in the loins. And so make sure you hydrate, make sure during the summer that you increase the amount that you drink, water and other fluids. And then, if you see any signs of blood in the urine or infection of the urine or any pain in the back, which is not going away, it's coming and going, and it's just go and get checked out.
Yeah.
The other is urine infections. Again, predominantly occur in women because of the anatomy. If you're getting recurrent infections, get tested, get evaluated, because there may be structural causes. Your bladder may not be empty because the water passages are a little bit blocked. There may be kidney stones, there may be bladder stones, there may be something more serious going on, like a cancer. So again, if you're getting repeat infections, don't assume it's just one of those things. Get tested out. And finally, urinary symptoms in men above the age of 40 often are caused by the prostate getting enlarged or getting tight. If those symptoms start to affect your quality of life, or if you start to see bleeding, or if you start to get infections, or if you start to get some discomfort, again, the earlier you go to your doctor, the better.
Yeah, amazing. Thank you. My last question is, where do you personally get your information for urology?
So good question. So it's a mixture. So, we all learn as medics from each other. So knowledge from your peers, knowledge from people coming up through the ranks, yourself, medical students, resident doctors who qualified and are in training. They often read other sources, and I get great joy from learning from them. And that includes medical students and even, elective students who come for a short period of time, or work experience students. You can always learn something. Textbooks are great, but they can tend to be outdated by the time, you read them. Guidelines from reputable sources like NICE, like the British Association of Urological Surgeons, the European Association of Urology has fantastic detailed guidelines on the best evidence and their recommendations.
I think. Thank you very much, Professor Ahmed.
Pleasure.